Great. Thank you, Ellen, for allowing me this time to be with CHIO's staff. Today, we're going to be talking about resources for stressful times and transitions, as Elaine mentioned. And I think many of us are experiencing that a little bit or to a great extent at this time. So I thought I'd just do a brief introduction to let you know who I am and a little bit about my work. My name is Jody Ryan, so nice to meet you. I've been a yoga teacher for 10 years, and I've just completed a 2-year yoga therapy program, and I'm just working towards finishing practicum hours before I apply for certification. I'm also a certified pain care yoga teacher, and I primarily work with people that have complex, chronic, long-term pain. But in along with that, often comes anxiety, depression, digestive issues, and often stress plays a major role in many of those things. I typically offer one-to-one private sessions, small group sessions, some online programming through Teachable, and then I do some workshops. So for today, we're going to be using and exploring some strategies that you might use during these uncertain times. I find in working with clients that it's often these transitions when things begin to kind of spiral out of control sometimes. And so we're going to look at that a little bit. We're going to practice. So probably 30 minutes or so, at least of this next hour is going to be practices. Simple and easy. We're going to use a bottom-up approach. So what do I mean by that? So a top-down approach is usually trying to think your way through something or calm yourself or alleviate your stress by using the mind. And we're going to use the body to look at how we might change our response to stress. So you don't need any prior experience, no special equipment. If you have a place wherever you may be where you can lie down for one of the practices, 2 of the practices, that would be great. If not, this is going to be recorded so you can always come back. And for the most part, you can do most of these just while you're seated anyways. Just to let you know, hopefully we will have some time for the questions at the end of the presentation. If not, you'll always be able to get in touch with me. So these transitions, they can be challenging and stressful. And we go through transitions throughout our day without noticing much about it. You know, we get up in the morning, we go to work. Working in the hospital, you might go from patient to colleague to patient's family. And how do you transition from one event to another, one conversation to another? How do you transition from being stressed to calm? Or from being rested to mobilized? And how might we transition from the start of this pandemic to the end? One of the things I'd like you to keep in mind is that your life, your history, your body, your environment, where you work, where you live is different from anyone else. Therefore, what you might need will be different from anyone else. And so getting some sense of agency or control over your environment can help, but it's really important that you feel and notice and do what's right for you. So during the practices over the course of the hour, I really encourage you to take care of yourself. Notice what feels right for you, notice what doesn't. If something doesn't feel right, then don't do it. So really take some control over what you're going to practice and what you're going to do. And probably from all of this that we've been through over the past year or so is we've come to know that we're all in this together. There's this connection. We are all connected, and what one person does impacts another, and that it's very hard to do all of this on our own. So just to begin with this transition into our next time together, let's just take a few breaths. So you can do that just as you are. You might want to close your eyes or soften your gaze, but just take a few breaths together and notice that you're now in this time and space together. And we're going to come back to this, but just know that social connection, science and research has shown that social connection is one of the best ways to alleviate long-term chronic stress. But we'll get around back to that a little bit later. So what are some of the strategies we might use or you might use? Well, I'd like to explore this a little bit today with you through some inquiry and exploration. And so that's just getting a little bit curious about what works for you. We're going to look at noticing. So really noticing what you feel and what you sense inside and whether it feels right and supportive for you or whether it doesn't. And then how might we respond to what we notice about what we feel, whether that's stress or something else. And then practicing that, practicing some resources. So to begin with, this inquiry and exploration, you're probably checking in on other people, inquiring, see how everybody's doing all day long. But do you take some time to really stop and notice what's going on for you? We're busy, we're all busy. This doesn't have to take long, but it is a good practice. And I use it in any of my sessions. I use it whenever I have small group classes. So we're going to do it now. And it just takes a couple of seconds. So what I'm going to ask is, first of all, we're going to kind of take notice and check out and inquire about, our external surroundings. So just that you may have been at work, you may be having lunch, you may be transitioning from one thing to another. And, what is the room that you're in now? Are you by yourself? Are you with other people? Can you notice the sounds in the room? And then we're going to take our inquiry into our internal experience, our internal environment. So again, do what's right for you. You might want to close your eyes throughout this or just soften your gaze a little bit. But just bring your attention a little bit inwards now. And you might first of all notice your breath. And typically, as soon as you bring your awareness to your breath, people will try to change their breath somehow. So try not to change it, just notice your breath. You might notice where you feel your breath. Maybe you feel it in your nose, in your chest, in your belly. You might notice some qualities of your breath. Does it feel easeful? Maybe a little bit shorter or longer than usual? Is there any sound to your breath? And then you might notice anything else you feel in your body. So you might feel some sensation. You might feel some tension somewhere. Perhaps you feel some pain or you have a headache. Maybe you're hungry. For me, I might feel a little butterfly in my stomach. I might have a little bit of nervousness going on. So what do you notice inside? And then just bring your awareness to your thoughts and emotions. So as you notice your body, are there any thoughts coming to you? Do you notice what your emotions feel like? So you're just checking in to see where you're at right in this moment. And then we'll end by just going back a little bit to your external environment, so you could open your eyes if they were closed. Feel your feet on the ground. Just take notice of anything you happen to notice, and maybe you didn't notice very much at all. So one of the things is when your breath is calm, muscle tension low, you're feeling okay. This sends a message to your nervous system and your brain that you're safe, that you can rest, that you have a sense of calm. So why might that matter? And let's take a look at our autonomic nervous system and how it reacts to stress. So you have these two pieces to the autonomic nervous system. And for simplicity's sake, we can just call one the sympathetic system our mobilization or alert system. And then we have our parasympathetic system, our rest or calm system. And although they create different responses, they kind of work alongside each other as well. Like you just don't go into one and then the other. You're often moving back and forth between the two all day long that you don't even really notice. But just briefly, this mobilization system, you'll notice perhaps your pupils dilate, your heartbeat will go up. With that, it inhibits the systems that are required to digest food. So perhaps if you're in this mobilized state, it's not so easy to digest your food. Conversely, in your parasympathetic response, heartbeat lowers, pupils constrict, then it's easier to digest your food. So they often call that the rest and digest system. But as I said, they kind of work in concert. So even on your inhale, your sympathetic system increases, your heartbeat goes up a little bit, exhale, it goes down a little bit. So you might want to think about that exhale and maybe extending your exhale and how that might calm the system a little bit. But as I said, most of this goes on without any awareness at all, but we do have some control, not over things like our glucose production, but we do have control over our breath, and that might affect these systems in some ways. So once you kind of check in and notice how you feel, how might you then respond? So if everything's all great, you feel good, you're calm, you're well fed, emotions are fine, you also just might want to take note of what might have contributed to that. So what happened before that allows for you to feel that way? And then if you are noticing feelings of stress or a change to your breath, some tension, inability to sleep, those sorts of things, maybe you feel some pain, how might you respond to that? And again, you might want to think back, like, why might I be feeling like that? What might have been contributors for me? But importantly for this session, what resources can you draw upon to maybe shift your state or shift your systems? So I just added this actually in yesterday because I listened to a podcast, and these are two really effective practices. If you're in a moment of stress, that there's some really good research and science going on about it. So I just wanted to include them here. One is what we call a physiological sigh, and the reference to one of the papers, this was a neuroscientist from Stanford whose podcast I was listening to. And he talks about the physiological sigh. And in yoga, we kind of, as he talked about this, it's like, well, that's what we call a Viloma breath. And he says that under your awareness, you probably do this all the time, probably when you're ready to fall asleep, when you maybe finish crying, and it's just 2 inhales followed by a long exhale. So there is some more information about, your CO2 level and your heartbeat and all that. But basically, you want to think about that long exhale too. So we're just going to give it a quick try here. So all it is an inhale again, and then exhale it all out. So let's try that again. Inhale, Inhale and exhale out. Inhale, inhale, and exhale out. Now he says that typically you can do this, so it's kind of a real-time, quick practice that you could use. One of the most effective that he's been able to find. So you might want to give it a try next time. And he says you really only need to do it 2 or 3 times. And then another one that he mentioned is about peripheral vision. So, curious about why that might be. If you're in a stress response, it's all about mobilization, and you need to respond and you need to do something. And it's usually, danger, fear, uncertainty related. And so you're kind of getting this tunnel vision. And he's suggesting that by taking your peripheral vision, taking your vision a bit wider and softening that, it kind of sends a message again to your brain and your nervous system to sort of calm things down. And I've used this before in my classes, more so about noticing your breath, but I thought we might just try it here. So you get a sense of what I mean by this. So if you want to place your hand kind of on your belly, so I'm going to place my hands just kind of under my rib cage. So that's basically where your diaphragm is. And just breathe normally here for a moment. Just get a sense of your breath. Just a normal inhale and exhale. And then I want you to find a spot or a place or a thing and really stare intently at it. In fact, so intently that you might actually squint. And then bring your attention to your breath and your muscle tension again. And notice what you feel while you're squinting, looking intently at your screen, perhaps. And then stop doing that and kind of take your vision wide. Like think about looking way off to the peripheral, so the way far end of each side. And again, if you still have your hands on your rib cage, notice what happens again to your breath. Now, it might be very subtle, but I certainly get a sense of when I'm like right in looking at something intense, not only does my body tense up, but I have a really hard time breathing. When I take my vision a bit wide, then everything seems to soften a little bit. I'm able to breathe a little bit better. So again, it just might be a really quick practice that you can do and see if it's helpful. Again, these are just suggestions. What might be helpful for you may not feel right at all for someone else. So releasing stress. So this is basically a quote by Dr. Robert Sapolsky. He's written the book. This is an old book, Why Zebras Don't Get Ulcers, but he's an evolutionary biologist. And basically he's saying that when we experience stress or worry, the same physiological responses that an animal would have to stress happens in us. But they release their stress. They fight, they flee, they do other things to release it. Whereas we often just kind of sit there. And so we don't have this physical response to release it. So it might actually be helpful to look at what other species, animals, cultures, or societies do to release their stress. So we're going to do this one practice, and I'll ask you to stand up. That's up to you. You could still, you can't really do it sitting down, but you could come back to it. But if you can, stand up. And, often people say when you're stressed or worried or something, they say, just calm down. Just calm down. Well, if it was easy to just calm down, we'd probably already be calmed down. So it's hard to use our thoughts and our mind to calm down, but you can use the body to change your physiological response. So we're going to practice using this. First of all, we're going to do a few different things, seated, standing. but this one is standing up. So if you'd like to stand up wherever you are, I'm going to stop sharing the screen for a moment. And let me just change my view here. And I'm going to come back to stand and do a little bit of practice for a couple of minutes. So again, often when we're stressed or we've got lots going on, you know, we're sitting still and we're trying to hold it all together. So it might be actually useful to move first, like maybe just move all together, or it might be good to move first and then maybe we can find some quiet. So first of all, you might want to just kind of, you know, if you're kind of up and full of anxiety or stress, it might be good to just kind of feel your feet on the floor. So I often say to find the 3 points of your feet. So under your big toe, baby toe, and center of your heel. So just to stand and get a sense of, can I actually feel my feet on the ground? And sometimes it can be helpful too to take something like a ball or something just to give yourself a little bit of sensation, roll them out a little bit on the ground, and then you might feel that a little bit better, more clearly. And then you may want to, or if you're having a hard time with that, you could actually like really push into the floor. So you could go, yep, I'm here, I'm okay, I'm safe, I'm on the ground. In this moment, everything is fine. Or you may want to kind of just move a little bit. Like you've had a hard day, you've had a hard morning. Might be nice to just kind of swing your arms a little bit. You can lift your heel, just kind of move. Maybe that feels good. Maybe you want to sway from side to side. So this is kind of a natural, soothing movement. You know, if you've got your little child or baby in your arms, we just tend to do this naturally. We kind of rock or sway from side to side. So again, if you're in a moment of stress, it might feel good to just get up and just do this and notice what it feels like. Or perhaps you want to rock a little bit back and forth on your heels, so toe to heel. Or maybe bounce. So, you know, we're always telling our kids, sit still, sit still, sit still. And then they, you know, what might be actually useful for them or for us is just get up and move for a minute. So you can be bouncing and then maybe shaking. So you might shake your hands. You might shake your arms. Notice what that feels like for you. You might shake your whole body. You might shake a leg. Sometimes you see animals or dogs like shaking their legs, getting rid of some stress. Shake your body. Maybe you start to dance. Anyways, it's just movement can sometimes be a bit of a release. So you can actually just pause. Notice how that feels in your body. And again, it may have settled your system a little bit, or it may have activated your system a little bit. For everyone, it's going to be a little bit different, but you can give it a try and see how that feels for you. So coming back, we're now going to talk a little bit about this brain and body connection, and then use some other practices that you might want to try. So this little fellow here is called the homunculus man. And it's basically an image to show, pardon me, how your body parts are mapped to the brain, how much area they're given to the brain. So we need to use our senses to keep ourselves safe. Things like our hands, so we don't touch things that are unsafe. We need to be able to hear what's coming. We need to be able to see. We need to be able to taste and smell to keep ourselves safe. So there's a lot of brain area mapped out to those particular body parts, which is shown in the diagram. So you don't really have so much space to your arm because there's not so much going on here, but you really need to know if you've tasted something that's going to be toxic to your system. So we're going to use some practices that you can use these particular body parts to, again, start to change your physiology, change the nervous system, change your brain. And some of these are kind of just, will give you a little bit of distraction. So maybe if your mind is going and you're stressed and you're worried and you can't seem to calm down, you might use this sort of as a distraction type of practice. Or it also may use it as another way of sending safety messages to the brain to kind of calm, move into that more calm parasympathetic nervous system response. So we're going to do a couple here. And you can just stay seated here. So you could just create some calm, again, by grounding. So feeling your feet on the ground, noticing your sitting bones, the bottom of your pelvis on the chair. So just sort of feeling that and knowing that in this moment, it's okay. You may sway or rock from side to side. That may change something for you. It may be soothing. Pardon me, kids, you'll see kids often do that. They're kind of rocking. It's kind of a self-soothing thing. Well, we could take some of these body parts that we talked about with the homunculus man and draw our brain's attention to them. So they could be simple things like these hand movements. So I'm going to put my hands up, but you could probably just have your hands rested on your lap. And we're just going to move our hands with our breath. So very simple. On your inhale, pardon me, draw your fingers to your palms. And then the exhale, let go and release. Sorry about that. Pardon me. Inhale, hands to the palm. Exhale, release. So just keep moving like that with your inhale and your exhale. You might want to close your eyes. Notice any tension even in your hands. See if you can soften in your hands. Maybe soften in the shoulders, soften through the jaw. Notice your breath. And then you could take your hands up a little bit as well. And not so much thinking about a deep breath. So I've talked a little bit about extending the exhale. So not deep breathing, but can we just have a little bit longer, softer, smoother breath? So taking the arms up, just inhale arms up and exhale them down. Inhale them up, thinking about that longer, softer, smoother breath. I sometimes like to bring in some imagery and think of, I've got these silk scarves blowing in the wind. And it's just this longer, softer, smoother breath. Or we might want to take our arms up on the inhale, bring the palms together, and exhale, lowering them down. Do that a few times. Inhale, arms up. And exhale, draw together. So this can kind of feel a little bit grounding, centering, calming as well, perhaps. Just short, simple, easy practices. And then you can kind of let that one go. And then we're going to try another one, and it's utilizing rhythmic sound, breath, movements of your jaw and your fingers. So we're kind of bringing in a lot of these body parts that are largely mapped to the brain to see if we can distract or find a sense of calm. So I'll say with this practice, I'll take us through. There's a lot to it in some ways, and also the fact that the length of my inhale and exhale will be different from you. So if it seems a bit confusing or it doesn't feel right for you, please just, sit and breathe and you can watch. But we'll try this together and then you can figure out how to do it at your own time frame. So we're going to use the sounds sa, ta, na, ma, kind of like an exhale. And then we're going to move our hands. So when we say sa, I'm going to ask you to bring your thumb tip and your index finger together. Ta will be the thumb tip and the middle finger. Na is the ring finger and ma is the baby finger. So we're going to go sa, ta, na, ma, and we're going to do that for each inhale and each exhale. So I'll lead you through it, and you can follow along in saying the words in your mind, or say them out loud if you want. We're going to do right hand, left hand, and then both hands together. So it's just using a lot of these different body parts in this practice. So first of all, just come back to your breath a little bit. Think about a long, calm inhale and a long, calm exhale. And then exhale your air out. And then on the inhale, you're going to go sa, ta, na, ma. Exhale, sa, ta, na, ma. Inhale, sa, ta, na, ma. Exhale, sa, ta, na, ma. Inhale, sa, ta, na, ma. Exhale, sa, ta, na, ma. Other hand. Inhale, sa, ta, na, ma. Exhale, sa, ta, na, ma. Inhale, sa, ta, na, ma. Exhale, sa, ta, na, ma. Inhale, sa, ta, na, ma. Exhale, sa, ta, na, ma. Both hands. Inhale, sa, ta, na, ma. Exhale, sa, ta, na, ma. Inhale, sa, ta, na, ma. Exhale, sa, ta, na, ma. Inhale, sa, ta, na, ma. Exhale, sa, ta, na, ma. And then just relax and breathe normally for a moment or two. And just notice how that feels for you. Now, it can be calming. It could be opposite to you. I find it's good for kind of distracting the mind, though. I know, having worked with people with pain, they find it useful if they've got something really difficult going on, and it can sometimes kind of take them out of that for a little while. The next practice that we're going to do is it's laying down. So this is one where I suggest if you can lay down on the floor, because there's a little bit of gravity working with it. If not, you could stay in your chair, and we're just going to be moving the head a little bit. We're going to be moving the arms, and we're going to be moving our knees. So I'm going to stop sharing again, go down to the floor, and then if you want to give this a try. So first of all, just get yourself comfortable on the floor. I'm going to go with a bit of a diagonal here, just so you can see what I'm doing. So just feel the weight of your body on the floor. You could put your feet out stretched or have them bent. Noticing your breath again. And then we're just going to start moving our head, rolling it from side to side. So if you're sitting up, you can take it from side to side. But I want you just to slowly, and then if you think you're going slowly, move even more slowly. Take your head and roll it from side to side. And you might start with a small range of motion. You might just move it a little bit. You might take it in a larger range of motion. Just get a sense of your head moving and how that might be easeful. And can you make your head move with the least amount of effort possible? And again, if you notice anything like you've got some tension in your shoulders, can you let that go? As you roll your head from side to side, you might want to stop and pause on one side or the other. Come back to the breath. Notice your body on the floor. Feel the weight of your body and your body taking up space on the floor. And then you could do that longer, but for the sake of time, I'm going to stop there. And then we're going to bring the arms and reach them kind of up to the ceiling. But again, just with ease and least amount of effort. You might want to make a little bit of circles with your wrists. And then you're going to bend at the elbows and hold each hand to opposite elbow. So there's kind of a square hole in front of you. And then we're going to take the arms from side to side. So we're kind of moving down the spine a little bit. And again, you might want to start with a small range of motion. So you might just move the arms a little bit to one side, an inch or two, and then to the other side. Just noticing what you feel in your shoulders, your neck. Can you make this even slower? Can you use less effort? So it's almost effortless. If you're sitting in your chair, you might want to drop the arms down and just have them swing like a pendulum a little bit. But as you're doing this too, you might notice maybe your head wants to move. So maybe the head wants to move opposite to the arms. Or maybe the head wants to move the same directions of the arms. So again, this practice is for you, what feels right for you. So you got to decide, what do I want to do? How do I want to do this? So just slowly back and forth. Head might want to stay still. You might want to just be moving the arms and not the head. Then you can let that go and put the arms down by your side, or maybe you want to put them on your belly. Notice your breath. And then we're going to take the knees from side to side. So again, starting in whatever range feels comfortable for you. So you might want to just move the knees a little bit from one side, a little bit to the other side. Notice what you feel in your hips, in your pelvis, in your spine, in your low back. Do whatever feels most right and comfortable for you. If you're sitting in a chair, you might want to just take your knees together and apart. That might work. Slightly different being on the floor, though, as I said. So if that feels easeful to you, you might want to take the knees wider. So you're almost doing a little bit of a twist. And maybe the head wants to move again. Maybe it wants to stay still. And then come back to center and just notice what you feel. So I find that to be a really calming practice. I kind of shortened it. You could do it for a lot longer. But there is this thing about, again, if you're in a stress response, you're going to be looking forward, you're going to be moving in the sagittal plane, so forward motion. You're not going to be doing this kind of side to side thing. So by doing this side to side movement, again, you're sending a message to the brain and the nervous system that I don't need to be stressed. I'm okay. Everything is calm. And so you can actually shift your physiology into that more restful, calming state. So it's, again, something you might try. A couple of last things, because I do want to get in a final practice, is I'm just going to do, well, there's two things. One is a great way to, just get some rest and what we call restorative yoga is you can, I always tell people, just lie on the floor. Don't lie on your bed, but lie on the floor, and then see if you can notice your bony structure of your body, supporting your body. And if you notice the bony structure, can you soften your muscles? Can you let the muscles go? Can you let the muscles relax? And maybe that feels calming for you. And even by doing that 2 minutes a day, whether it's 11 o'clock in the morning, 3 in the afternoon, just lay down and rest for 2 to 3 minutes, let everything settle, might be useful. The other thing that restorative yoga is good for is support. So support. So I'm going to show you one practice that's really great. You can do, I'm not going to do it now because of time, but legs up the wall. But this is great too. You can just put your legs on a chair, on the sofa, on your bed. And then I'm going to add a couple of pieces to this just to give you further support. So you roll over and just put your legs up on something. And then again, as I talk about allowing the muscles to release and relax, even in this position, you're probably still holding a little tension to keep your legs from going like that. So if you can take a belt or a yoga tie or something and put it around your legs. So I've got them around mid-thigh here. And I've just got it tight enough so it's holding my legs. So I don't have to hold my legs anymore from falling apart or together. So it's just some additional support. And I often find this really helpful for people just to relax at the end of the day or partway through your day. And then another thing you might choose to do is you might want to add some weight. So again, this is very individualized. For some people, you've probably heard about weighted blankets and things. For some people, it feels really great. For other people, it might feel anxiety-provoking. So you can just give these things a try. I've got a sandbag here, but you could use like a bag of rice and not putting it on your belly, but moving it down along your hip crease, just to add a little weight, little safety, security, comfort. You could add some weights to the hands. So I've got some weights here, but you might use, I've told people you could just use a can of soup and put it in each hand. And again, it just gives you that sense of security and sense of grounding. So you could add that. You could also add, I've got an eye pillow here, but this can be also calming for the eyes, just to cover them, have a little bit of weight. If you don't have an eye pillow, you could just use like a face cloth or something, just to add a little bit of weight and to cut out the light and just stay in this position. So just a couple of different ideas that you might want to try, just to get a sense of rest. So when we're stressed, as you noted when we looked at the two systems, it's hard to get rest if you're in that stress response all the time. So that person that we did the first two practices that mentioned Dr. Huberman from Stanford, he talks about non-sleep deep rest. And if you can do this for even about 20 minutes a day, it's almost, it can be really, really helpful if you're not sleeping well at night. He calls it non-sleep deep rest. We call it in Yoga Land.
I just accidentally muted you, I think, Jody.
Okay now?
Yes, sorry about that.
Was it muted for a long time?
No, just now, because I had to wake up my mouse. So
okay.
Just clicked on the mouse
okay, great. So we did the rolling practice. We did a little bit of the restorative practices. I just want to touch on routine. So those of us that have kids kind of know this. Routine is good for kids, typically. But our brain works on predictability. And when everything is unpredictable and uncertain, any kind of routine that you can add to your day will be very useful, very practical. I'm going to skip through a little bit because I really do want to get to our last practice of the day, and it's about compassion. And can we have a compassionate response to stressors? And this is from some of the work of Shelley Prosko, another yoga therapist, researcher, and really based on the research of Kristen Neff that I've referenced here. But it seems so natural and easy to be compassionate. You know, you people working in CHIO, compassion, care, looking out for everybody else. And then it's hard to give the same care and compassion to ourselves sometimes. So can we actually relearn how to do that? How do we be genuinely nurturing and supportive to ourselves? So I'm going to take us through a practice. You can just stay seated. I'm going to go through it with you. And this is, again, is Shelley Prosko's practice. And there's three pieces. One is being mindfulness. One is about our common humanity. And one is kindness. So we'll just finish up with this practice, and then we're pretty much done. So you can just sit quietly. If you're lying down still, you can lay down, have your eyes open or closed. But we just want to think about a time perhaps, and not something really, really hard, but maybe something that, you know, when you feel frustrated or stressed or anxious about something. So you might be in a moment of stress or distress. And so you might notice and acknowledge that you're in this moment, that you are stressed and that you are suffering. And even acknowledging and accepting that can sometimes be helpful. So we're going to just briefly again scan once more through the body, through all the layers, or we call them in yoga koshas. So just notice the general state of your thoughts and emotions now. You might feel the same as when we started. You might feel a little bit different. Become aware of your breath again. Breath is always with you, so it's something we often bring attention to. Notice the quality, the length of your inhale or exhale. Then notice the state of your body, the general state. So any physical sensations, the temperatures and tension you might have in your body, just notice what that's like in this moment. Then notice your overall energetic state. Do you feel tired? Do you feel energetic? Somewhere in between? And then see if you can get a felt sense of connection to your true self, or a sense of your spirit, who you are. And then notice any judgments or stories that mind is creating. And you're just watching and observing these characteristics. You're just noticing, not trying to change anything, not making anything wrong. And then the common humanity. Can you recognize that other people have shared this experience? That you're not alone? And this acknowledgement may provide some comfort. You might try some kind of intention or mantra. We use in yoga, Loka Samasta Sukhino Bhavantu, just that may the whole world be in peace and harmony. And you just want to create a sense of belonging and capacity, a connection to the rest of humanity. And then you want to take that opportunity to extend kindness to yourself. So if it feels right to you, you might want to place your hands on your heart. And as you breathe in, imagine the breath is softening the area around your heart. And silently say to yourself, it's okay. And as you breathe out, take your time and imagine letting go of any tension around the heart and just saying, this is enough, in a tone that's patient, soothing, and forgiving. So on your inhale, it's okay. Exhale, this is enough. Inhale, it's okay. Exhale, this is enough. Again, just another practice that you might want to try. And I'll just say that, for all of these practices, you don't have to do all the things. What's the thing for this? What's the thing for stress? But just have a look and see what feels right for you. Some of these may have felt supportive. And maybe put that into your routine a little bit. And then just going right back to where we started, connection. One of the best ways, as I said, to alleviate long-term stress is through connection to others, to self, which is hard right now. But it could also be, connection to a pet. You might feel really connected to nature. Something that brings you some delight can also be really supportive. Just acknowledging some of the people I've learned from, my teachers, and all the people I work with. And to say thank you for your time. We're almost out of time, so I don't know if we have any questions or comments, but I'm on Instagram, Facebook, Twitter, or you can email me at yogatools4life.